I'm going to ask the panelists, Beverly, Stephanie, Megan, and Winifred, to unmute and come back on video, because we're going to try and address some of the questions that came up. There were many, many, many questions. And actually, there were some very helpful responses that you all did during the discussion and that participants shared with each other. So left a lot unanswered. Some we're going to have to follow up with and get the answers from the state. Some, I would guess, have not been resolved yet, and that'll be something that will come out in the future. But a couple of top line questions for me. There are a number of questions. One of the first ones was about aligning childcare and preschool classes, and then a number of questions about after-school childcare. I think, as you know, the school districts are also struggling with what's going to happen in September. Are they going to open? What's it going to look like? I would say those issues have not been resolved, but they are certainly on the minds of people in the Department of Education, and also come up as an issue. Senator Rees has a working group on reopening education, and these issues have come up. So stay tuned for that. There'll be more on that. Lots of questions about the logistics of opening. How do you stagger hours? How do you bring kids in the program? And I know, Stephanie, you talked about that a bit. If you could address that a little more.
Yeah, thanks. Some great questions. We have not been staggering pickup and drop off for emergency childcare, and that's truly based on the numbers and that we kind of have a handle on who's coming and when they're coming. We will be sending, my families have until tonight to make a decision about whether or not they're coming back on June 15th. We're doing it in waves. And tomorrow they will receive a survey asking them, like Megan alluded to, what are the actual times that they need versus for pickup and drop off. And we will be asking them to commit to that because we can't have all 70 kids show up at 7:15. That's just not going to work, right? And we also can't have, I can't stand outside for 4 hours a day. If I know nobody's going to come between 8 and 9, then we're not going to do a drop off between 8 and 9. We obviously are human. Everybody else is human. We're going to be flexible with our families when we can. But in the beginning, I think we need to have a really good plan, and we need to be transparent with our families that we're all navigating this together. So that we might start off one way and the second wave is going to look a little bit different.
So many of the issues had to do with funding. And I think I'm going to turn it over to Beverly for questions around subsidy.
So yesterday, the commissioner and Assistant Commissioner Natasha Johnson talked about childcare subsidies. We had already notified childcare directors that subsidies would continue based on your enrollment through June 30th. So now that has been extended for the month of July. So whatever children were enrolled in your program March 1st, you will continue to receive a subsidy payment for those children through the month of July, with a couple exceptions. One, if that child goes to another center, of course, we would pay at the new center. Two, if the child moves out of the state, they would no longer be eligible for services. And three, if they age out of child care subsidy, they would no longer, you would no longer be paid. But at this point, those are the only three exceptions to children being paid for. So let me just repeat that. If you receive child care subsidies now, the children that were enrolled in your program effective March, during the month of March when the pandemic started, you will continue to be paid for those children through the end of July.
Thank you, Beverly. Lots of questions about what if I have to hire new staff? How do I go about finding staff? And I think, Megan, you might have replied in the chat box, but you can talk a little bit about what you put in.
I just put a resource that we have for NJYC on our shared resources page. There's an Acquire for Hire, which is just a resource to find staff and to post for jobs. So I wanted to put that out there as a resource. I think hiring new staff is something that the entire industry is going to have to look at, and not only just rehiring, but restructuring the type of work full-time versus part-time versus shift work versus even job descriptions of what they're doing. And so that may also affect who they're looking for. So hopefully that'll be a resource that can help.
Great, thanks, Megan. Anyone else on where to look for staffing? Okay. Thank you, Megan. I saw that on the chat and thought that was interesting. Lots of questions about wearing masks, both children and teachers. Stephanie, I know since you've been in an emergency center, how have you handled that?
So 100% of staff are required to wear masks, and that's the long and the short of it. This is not up for discussion right now. I think we just have to recognize that there are things that we can control, and be flexible and be creative. This is not one of those things. If you didn't catch the New Jersey Department of Health and Safety webinar yesterday on YouTube, it's on their YouTube channel. After I'm done talking, I can find it and post it in the chat box. But they did talk about masks with children. So I would urge you to go and watch that. As a mom, I have two little ones, and as someone who's running emergency childcare, I have 2 suggestions about mask wearing. Kids need to practice wearing them. It takes them about 2 weeks to get comfortable. So we started practicing while they were riding their bikes. If you have your hands on the handlebars, you can't play with your face and your mask. So it actually worked out really well, and we would do that for 5, 10, 15 minutes increments. And then the second round of that was just obviously real little kids. It's not going to be the same, like a 3-year-old maybe with a scooter or something. But having them wear their mask when they're doing something they really enjoy, playing with slime, playing with Legos, where that's not going to be the focus. And the more you engage in those activities, the more comfortable and the more used to, they're not going to wear it 100% of the time correctly. But we know that this mask wearing stuff is probably not going anywhere anytime soon.
Thank you. I know a number of questions have come up about access to information or help, first around infant mental health needs or mental health needs of both children and staff, as well as health questions. And Beverly, you mentioned the health consultants. Can you talk a little bit more about them?
Absolutely. I believe there are 4 or 5 childcare health consultants now. Patricia is putting that information in the chat box. They are available to provide assistance to childcare centers and home-based providers as well, in providing technical assistance around the things that you have concerns with related to health. I just want to say that they have been doing webinars for the last 2 months in preparation for centers to reopen. They continue to do those webinars, and they have been really very informative and have helped centers and home-based providers significantly. So there are numbers in the chat box along with an email address.
Okay. Questions about other people in the building. A number of you asked questions about programs that are located, for example, within a church, where there are church personnel there, or your administrative staff in the center and what their interaction can be. Not sure who to address this to. I don't know, Winifred, Stephanie, whoever can.
I would talk to your licensing representative. He or she will be able to answer that most appropriately. I'm leaning toward the side that folks who are in the building need to be on your payroll. They need to be carried and background checked by you. They've outlined in our guidelines, volunteers are not permitted in the building. Non-staff people are not permitted in the building. So, but talk to your licensing rep.
I would echo that. All the programs in the state are very different. And so as you move through this guidance, if you fall into like an obscure category, you want to reach out to your licensing official ahead of time. But keep in mind that the grouping of the guidance was to not mix groups of people so if you have people from, say, a church facility or a school facility that are coming into your group, it's that mixing of group that they're looking to. So I would echo what Stephanie said, that that's probably going to be against the guidelines.
Great. Quite a few questions, which I'm not sure if anyone has the answer to, because I'm not sure it's been decided, but I'll put it out there to the panel, is around mandatory testing. Can teachers be required to be tested? Can students be required to be tested? My sense is this has not been resolved yet, but I'm going to put it out there to the panel. If anyone has a response to that.
I would talk with your local board of health, and if you have legal counsel, to have them review any policy or procedure about that.
Okay, thank you. I'm going to pause here and see if the panelists have any last comments they want to make before I close.
I would just like to say to everybody that keep in mind that these guidelines are a first step. They're going to be released and loosen up as we move through this. So things that we're thinking through and navigating right now are not your forever. And if you need that kind of that calm that Winifred was speaking of, just take a breath and recognize that this is just a moment in time, and that the entire state industry is going through it together.
I just want to encourage the child care directors that are listening today. Again, you're not alone. All of us are willing to support you and help you and talk through things. I also want to say that if you are a director, you have unclogged the sink, you have shoveled snow, you have worked in the kitchen, you have done the payroll, you've been a substitute in the classroom, and this I don't think is any harder than all of those other jobs that you've had. But if you plan it well, I think you'll all be all right. And again, the goal is to keep everyone open so that you can continue to provide services.
Thanks, Bev. Winifred, any last words?
I would just say we've got this, and echo all the words that everyone else has said. We can do this, and we're all in this together. And use your licensing inspector really as a coach. That's what they're here for.
Great. Thank you. And Stephanie.
All the same things. We got this. Reach out. There are so many directors networks. You do not need to reinvent the wheel. Find somebody who's already done it. We are a team, and I know that for a long time there's been this idea that all the childcare centers are, competing against each other. We're not. We all offer very different programs, and just keep that in the back of your mind. And as so many childcare centers are not going to come back from this, we are in the responsibility is on us to build programs that keep everybody safe and that keep our communities vibrant. We're a social network. We're a lot more than just providing childcare, and you all know this. So when things get hard, just keep that in mind and reach out. If you are not a part of a directors network, find a directors network. Go on Facebook. I'm seeing everybody shake their head. So we all know the directors networks. Contact us. We will get you involved with one of them so that you don't have to do this alone and that you don't have to reinvent the wheel. It's not going to be easy, but it's going to be worth it.
That's a great place to wrap up. And Stephanie, you touched upon something. It seems to me in monitoring the questions and listening to you, you are an incredible resource to each other. And that opportunity to talk to each other, answer questions, how are you doing it? How will you address this is amazing. I'm happy to hear that there are director networks. If people are not connected in that way, let us know, because we'd like to make those connections. I really have been very impressed in this conversation and in conversations we've had for the last 3 months with childcare professionals across the state, as to the incredible resource that you are. And also, I think each of the panelists talked about approaching this in a positive way. ACNJ has worked with providers to meet with our congressional representatives to advocate for federal money. And what's been most impressive to me is that these conversations have been forward-facing. These conversations have not been, I'm stuck, I can't do this. It's, I want to do this. How can I do that? I need help to do this. I think, and Beverly's right. I think the childcare community has always done everything. And this is another example of that. I'm just impressed by all of you. And you should all feel that the rest of the world now appreciates childcare for what it is, the way you always have. All of a sudden, light bulbs have gone off. Cindy will tell you the example. We met with Congressman Kim by Zoom on Monday night. And he met with us himself, not his staff. And he had his I think they were 2 and 3-year-old children because he was babysitting for them that night. That was the best way for him to really understand, not that he didn't understand. So I think that people are looking at childcare in a different way. And the fact that our governor said childcare was necessary, not just to reopen, but to reopen the state. So kudos to all of you. I think you're a wonderful resource for each other. Okay, the follow-up. One is we've recorded the questions in the chat, and we will pull them together into FAQs that we will send out and post on our website. 2, this webinar has been recorded. That will be available as well on our website, and I'm pretty sure we'll send out a link to that. 3, if you're not familiar with ACNJ, we're an advocacy organization. Check our website. We put up resources as we hear about them. It's www.acnj.org. And we have a COVID page with lists of resources, some of which you've seen listed in the chat box. And then finally, join us next week for our webinar on Tuesday, looking more at the operational issues, and some of the questions that have come up will inform that. And then on Thursday, looking at the employment issues. Both are at 1 o'clock. And they were, I think, included in the notice of this webinar, but they can be found on our website. So on behalf of ACNJ, I just want to extend a thank you to Beverly for this idea. I have to say, when the numbers started rising about people who were interested, it, 1, convinced me that this was exactly the right thing to do, and 2, terrified me. But thank you for the idea and for helping to arrange this. And thank you to our panelists for taking the time to share your experience, expertise, and ideas. And thank you to all of you who participated. You have also provided some information and sharing that can only make this the strong system we want it all to be for children and families. So thank you all very much. This concludes our webinar, and I hope you all have a great weekend, and I hope you join us again on Tuesday.